Artificial contraceptive methods. Oral contraceptives. The combined oral contraceptive pill COCP, often referred to as the birth control pill or colloquially as the pill, is a type of birth control that is designed to be taken orally by women. The pill contains two important hormones, progestin, a synthetic form of the hormone progestogen, progesterone, and estrogen, usually ethinylestradiol, and 17-beta-estradiol, 9-10-11. When taken correctly, it alters the menstrual cycle to eliminate ovulation and prevent pregnancy. Some advantages of the pill include: it does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS, premenstrual syndrome. It can sometimes reduce acne. It may protect against pelvic inflammatory disease. It may reduce the risk of fibroids, ovarian cysts, and non-cancerous breast disease. Some disadvantages of the pill include: it can cause temporary side effects at first, such as headaches, nausea, breast tenderness, and mood swings. If these do not go after a few months, it may help to change to a different pill. It can increase your blood pressure. It does not protect you against sexually transmitted infections. Breakthrough bleeding and spotting is common in the first few months of using the pill. It has been linked to an increased risk of some serious health conditions, such as blood clots and breast cancer. Transdermal patch. A transdermal patch is a patch that attaches to your skin and contains medication. The drug from the patch is absorbed into your body over a period of time. If you'd rather not have a pill or an injection, a patch may be a more comfortable option for taking some medications. Transdermal patches are used to deliver a range of drugs into the body. Some of the drugs more often used in patches include fentanyl to relieve pain, nicotine to help with quitting smoking, clonidine to treat high blood pressure. Transdermal patches are easy to use, but for them to work well, it's important to use them properly. This article provides step-by-step instructions and graphics on how to apply and use a transdermal patch. Advantages of transdermal patch. Transdermal delivery offers several benefits over oral delivery, including smooth, continuous drug delivery, increased bioavailability, and reduced drug interactions. Patches can be easily applied by the caregiver, and they provide a visual cue that the medication has been administered. Disadvantages of transdermal patch. The patch is not a perfect means of contraception. Because of some drawbacks listed below, it does not provide protection against sexually transmitted infections (STIs), including HIV. Must be prescribed by a healthcare provider. The estrogen levels are higher with the patch than with other hormone. Vaginal ring. The vaginal ring NuvaRing is a small soft plastic ring that you place inside your vagina. It releases a continuous dose of the hormones estrogen and progestogen into the bloodstream to prevent pregnancy. How the ring work. The ring steadily releases the hormones estrogen and progestogen into your bloodstream, which prevents the release of an egg each month. It also thickens the cervical mucus, which makes it more difficult for a sperm to move through the cervix, and thins the lining of the womb so a fertilized egg is less likely to implant itself. Advantages and disadvantages. Advantages. It doesn't interrupt sex. It's easy to put in and take out. You don't have to think about it every day or each time you have sex. The ring isn't affected if you're sick, vomit, or have diarrhea. It may help with premenstrual symptoms. Period type bleeding usually becomes lighter, more regular, and less painful. Disadvantages. You may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. It may cause temporary side effects, such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood changes. The ring doesn't protect against STIs. You need to remember to change it and put in a new one. If remembering to do this is difficult, a longer acting method such as the contraceptive implant or intrauterine device may be more suitable. Some medicines can make the ring less effective. See a GP, nurse or pharmacist for advice. It may take a while for you to return to normal fertility. In some women, this may take up to a few months. Subdermal implants. Subdermal contraceptive implants involve the delivery of a steroid, progestin, from polymer capsules or rods placed under the skin. The hormone diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer. Advantages. Advantages of progestin implants include long-term contraceptive action without requiring the user's or provider's attention, low dose of highly effective contraception without the use of estrogen, and fertility is readily reversible after the removal of implants. Disadvantages. You may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swings. Your periods may be irregular or stop altogether. You may get acne, or your acne might get worse.
Hormonal injection. The contraceptive injection prevents pregnancy by injecting a synthetic version of the hormone progestogen, called dipomedroxyprogesterone acetate, or DMPA. The injection is also called Depo. Depo prevents the body from producing its own hormones and releasing eggs from the ovaries. Advantages. Each injection lasts for either 8 or 13 weeks. It does not interrupt sex. It's an option if you can't use estrogen-based contraception. You do not have to remember to take a pill every day.
It's safe to use while you're breastfeeding. It's not affected by other medicines. It may reduce heavy, painful periods and help with premenstrual symptoms for some women.
Disadvantage. Your periods may change and become irregular, heavier, shorter, lighter, or stop altogether. This can carry on for some months after you stop the injections. It does not protect you against STIs. There can be a delay of up to 1 year before your periods return to normal and you can become pregnant. Some people may put on weight when they use Depo-Provera or Cyanopress contraceptive injections. You may experience side effects like headaches, acne, hair loss, decreased sex drive, and mood swings. Any side effects can continue for as long as the injection lasts 8 or 13 weeks and for some time after. Intrauterine device. An intrauterine device UD, also known as intrauterine contraceptive device UCT or ICD or coil. 3 is a small, often T-shaped birth control device that is inserted into the uterus to prevent pregnancy. IUDs are one form of long-acting reversible birth control ARC. For one study found that female family planning providers choose LARC methods more often 41.7 than the general public 12.1.5. Among birth control methods, IUDs, along with other contraceptive implants, result in the greatest satisfaction among users. 6. Advantages. It protects against pregnancy for 5 or 10 years, depending on the type. Once an UD is fitted, it works straight away. Most people with a womb can use it. There are no hormonal side effects, such as acne, headaches, or breast tenderness. It does not interrupt sex. It's safe to use an UD if you're breastfeeding. It's possible to get pregnant as soon as the UD is removed. It's not affected by other medicines. There's no evidence that an UD will affect your weight or increase the risk of cervical cancer, womb uterus cancer, or ovarian cancer. Disadvantages. Your periods may become heavier, longer, or more painful, though this may improve after a few months. It does not protect against STIs, so you may need to use condoms as well. If you get an infection when you have an UD fitted, it could lead to a pelvic infection if not treated. Most people who stop using an UD do so because of vaginal bleeding and pain, although these side effects are uncommon. Chemical barriers. Chemical barriers against infection include enzymes in tears, saliva, and mucus that break down the surface of bacteria. The acid in sweat and in the stomach kills cellular pathogens, and there are antibacterial proteins in semen, the fluid that contains male sperm. Disadvantages. These methods do not prevent pregnancy. as well as IUDs or hormonal forms of birth control. Barrier methods prevent pregnancy only if you use them every time you have sex. You may have to interrupt sex to use some barrier methods of birth control. Advantages. Barrier methods of birth control act as barriers to keep sperm from reaching the egg. Some barrier methods also protect against sexually transmitted infections (STIs). A few barrier methods, spermicide, condom, and sponge, can be bought in most drugstores. Cervical cap. The cervical cap is a form of barrier contraception. A cervical cap fits over the cervix and blocks sperm from entering the uterus through the external orifice of the uterus, called the os. Advantages. Unlike the diaphragm, the cervical cap protects against pregnancy for 2 days 48 hours and for multiple acts of intercourse within that time frame. When placed appropriately, the cervical cap is often not felt by either partner during sexual intercourse. Disadvantages. The cervical cap is more difficult for women to learn to insert and remove than the diaphragm. If worn for more than 2 days 48 hours, you run the risk of toxic shock syndrome or unpleasant vaginal odor and discharge. Mild allergic reactions to the silicone or spermicide occasionally occur. Male condoms. A male condom is worn on the penis. It is usually made of latex, a type of rubber, but some are made of materials that are safe for people with latex allergies, such as polyurethane or polysoprene. Some advantages of using condoms. When used correctly and consistently, they are a reliable method of preventing pregnancy and protecting both partners from STIs, including chlamydia, gonorrhea, and HIV. Disadvantages. Some people are embarrassed to use condoms or feel they may interrupt foreplay or intercourse. Both partners must be comfortable with using a condom and be prepared to use one every time they have sex. Condoms may decrease sexual sensation. Some people are allergic to latex rubber. These couples should use condoms made of polyurethane plastic. Condoms may break or leak. Failure rates for barrier methods are higher than for most other methods of birth control. Using an additional method of birth control is a good backup measure in case a condom breaks. If a condom does break and you are using no other birth control method, you can use emergency contraception to help. Female condoms. A female condom is inserted into the vagina. It has a flexible ring at either end. One end is closed and goes into the vagina. The other end is open and the ring sits outside the opening of the vagina. Female condoms are made from materials safe for people with latex allergies. Female condoms help to protect both partners from STIs, including HIV. When used correctly, they're a reliable method of preventing pregnancy. It's a form of contraception you only need to use when you have sex. There are no serious side effects. Disadvantages of female condoms. They can slip out of place during sex. They can irritate your or your partner's skin. They might make the sensation of sex less intense. If this is a problem for you, try to make putting in the condom part of sex play. They're slightly less effective at preventing pregnancy and STDs than male condoms. They can be noisy, but you can use more lubrication help or put it in early so it has time to warm up to body temperature. They cost more than male condoms. There's only one size. Tubal sterilization, also known as tubal ligation or having your tubes tied, is a permanent method of contraception that you can choose if you are sure that you do not want to have children in the future. Using keyhole surgery, the surgeon puts clips on the fallopian tubes to block the sperm and egg from meeting. Advantages. More than 99% effective at preventing pregnancy. Blocking the fallopian tubes and removal of the tubes should be effective immediately. But use contraception until your next period. It will not affect your sex drive or interfere with sex. Disadvantages. It requires a surgical procedure. Effective contraception must be continued for a period of time following sterilization, depending on the method used. People may regret having had the procedure. It cannot easily be reversed, and the NHS does not routinely offer reversal procedures. Natural methods. How does abstinence work? Abstinence is the most effective form of birth control. If two people don't have sex, sperm can't fertilize an egg and there's no possibility of pregnancy. Other forms of birth control. Abstinence can be a way to avoid the risks that come with sex like pregnancy and STDs until you're ready to prevent and/or handle them. Abstinence can also help you focus on disadvantages of abstinence. Experience shows that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Many people may find it difficult to maintain abstinence over the long term. Calendar method. The calendar method helps you predict your fertile days by tracking the length of your menstrual cycles over several months. How do I use the calendar method? Before you can use the calendar method as birth control, you need to keep track of the length of your menstrual cycles for at least 6 periods. You can do this with a regular calendar or our period tracking app. The benefits of calendar-based methods include: they are natural and do not cause side effects. They do not require any special devices or procedures and do not cost anything. Women become more knowledgeable about their menstrual cycle when they use the method. Disadvantage: the biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to be 100% sure what days you're fertile. Basal body temperature. The basal body temperature method, a fertility awareness-based method, is a type of natural family planning. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. You'll be most fertile during the 2 to 3 days before your temperature rises. By tracking your basal body temperature each day, you may be able to predict when you'll ovulate. This may help you determine when you're most likely to conceive. Disadvantage: the biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle, and even then, it can be hard to be 100% sure what days you're fertile. Advantages: basal body temperature can be used as a way to predict fertility or as a part of a method of contraception, by helping you gauge the best days to have or avoid unprotected sex. Tracking your basal body temperature for either fertility or contraception is inexpensive and doesn't have any side effects. Cervical method. The cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus for either fertility or contraception is inexpensive and doesn't have any side effects. Some women choose to use the cervical mucus method for religious reason. Advantages: it is very effective at preventing pregnancy. It is considered a permanent method of contraception. Disadvantages: it requires a minor surgical procedure. Symptothermal method. Symptothermal method, a fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. How the symptothermal method works. The symptothermal method works by recording daily observations of the woman's fertility. The woman's basal body temperature, cervical mucus, changes in the cervix, and other symptoms of ovulation. What is symptothermal method? Advantages and disadvantages. The symptothermal method has a significant advantage in effectiveness because it combines the calendar, cervical mucus, and temperature methods. However, this technique shares the same disadvantages that each of these techniques has individually. Ovulation detection. An ovulation home test is used by women. It helps determine the time in the menstrual cycle when getting pregnant is most likely. The test detects a rise in luteinizing hormone LH in the urine. A rise in this hormone signals the ovary to release the egg. This at-home test is often used by women to help predict when an egg release is likely. This is when pregnancy is most likely to occur. These kits can be bought at most drugstores. LH urine tests are not the same as at-home fertility monitors. Fertility monitors are digital handheld devices. They predict ovulation based on electrolyte levels in saliva, LH levels in urine, or your basal body temperature. These devices can store ovulation information for several menstrual cycles. Advantages: ovulation test kits may be beneficial if you have slightly irregular periods or find other methods of tracking your fertility difficult or unreliable. Disadvantages: ovulation test kits can be expensive and there are no guarantees. Coitus interruptus. Coitus interruptus, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. Advantages and disadvantages. Coitus interruptus, or withdrawal as a contraceptive technique, does not make use of artificial devices. However, it does have several disadvantages. 1. Men discharge a small amount of semen before ejaculation. 2. Men withdraw their penis late and inseminate the female. And 3. Side effects include loss of sexual interest, limited arousal, and pleasure from foreplay.
Thanks for watching.